addressing decades of neglect in Ipoti, Ekiti and its environs, Grace and Mercy Hospital and Wellness Center would require massive support to spring into reality. The sons and daughters of Ipoti Ekiti are heaving a sigh of relief at the prospect of playing host to a hospital facility denied them by a country rated as the 6th largest oil-producing nation in the world. As they turn to Jesus and His church for redemption through Grace and Mercy Hospital and Wellness Center, they crave for donor support.
This is a 50-bed hospital, but we're going to have, we have 9 beds in the labor and delivery units. We have the nursery, which is going to have 10 cribs. We have 10 beds in the postpartum, which is like after they have their baby. We have the 6 beds in the special care unit. And we have the wellness center, which is just geared towards disease prevention and wellness. So there's going to be different clinics in that area. That's the middle part. And we have the emergency, because it's an intermediary care hospital, but in spite of that, people that comes that needs a tertiary care, we're still going to care for them. So we have the emergency units here, and then we have the surgical units. We have we have 9 beds in the surgical units, 9 beds in the emergency unit, medical units, and then we have 6 beds in the pediatrics, the children's section.
Now, to fund this project, the ministry will rely on people of goodwill. Like if God bless you, you say, listen, I'm going to take care of the doctor's residence. We name that doctor's residence after you. If you said, okay, I'm going to give towards the building of the main hospital, maybe it's the emergency unit. We have people in the United States who are doing that. When heart attack was killing everybody in the US, some big people came over and donated generally to some hospitals to fund research. And what we found out that they were able to know how to prevent heart attack.
Global Mission Outreaches hopes to empower Ipoti Ekiti and the larger Nigerian community by delivering quality health care to our people long held down by government apathy to efficient health care delivery. And now, with ongoing global financial challenges, it is feared that government may even withdraw further from committing funds to the health sector. A United States-based organization, Save the Children, predicts that about 1 million children will die yearly in Nigeria due to lack of access to basic health care. It says Nigeria's primary, secondary and tertiary health institutions have virtually collapsed. Experts are, in view of this cheerless outlook, calling on stakeholders and Nigerians generally to cast their sights elsewhere for relief. Thus, the proposed Grace and Mercy Hospital in Ipoti Ekiti offers the most acceptable alternative to the people's healthcare needs. However, the scheme requires financial and moral support to meet its ambitious objectives.
Láwọn tó ń gbé bọ̀ torí pé ibi tán ti ń gbé bọ̀ tó dẹ̀ jẹ́ pé ìlú Ìpotì lọkọ̀ wọn sọ láti gbé wá iṣẹ́ Ọlọ́run. Kò ń fẹ́ kó yàmọ́ jẹ́ àmẹ̀kúnnù ká lálàáfíà ká yọ̀ lu àlàáfíà pípé lọ́ra oníṣẹ́ mọ́sibítù kwá.
This is a project that God Himself has already finished. He has already completed it, and that is where we are keeping in view what the Lord has done. And that is why we're in the spirit walking along with the house of God.
This project is going to be a many-faceted project where you are going to have not only healing, but you are going to have researches. And this is the area in which when they do researches into our common ailments, then we know how to go to other places to go and treat our ailments. Because there are certain ailments that are specific. And this is the area that we should go into as academics so that we are trying to listen to them.
We are going to coordinate all the egbes outside Ipoti to donate and be a part and parcel of this project. God helping us.
Those who love Ipoti, who are not even Ipoti in the diaspora, to contribute, whether it's equipment, whether it's material, that is needed to see that this project comes to fruition.
In Lagos and Ikoti-Ekiti, there has been encouraging response with individual pledges of funds, building materials, services with political and logistic assistance.
I thank God for Bola Adewunmi Global Ministries, who have responded to the cry of God, who have responded to the heartbeat of God, not because they are ordained ministers of the gospel, but because God has called them and has sent them.
Millions of people in this country have been blessed financially. They've made money, tremendous wealth, but they are not applying it back into the system. So I think with what people have started, it's a step in the right direction for other people to implement.
To be able to support the project, you'll be surprised what people begin to do from today. From this day that the project is going on, you see the way people are going to begin to respond.
It is a great inspiration for other people to follow their footsteps. It's a very noble intervention. So whatever the church is doing, they see it as a manifesting of God's blessing. I think the church should be involved in church intervention.
It's a challenge. And we have Ikoti sons and daughters that are well placed. As I said, when I get to Ikoti this week, I will put 1,000 blocks there to start off. Amen.
There is a comprehensive variety of programs and projects under the scheme that can benefit from the generosity of partners. Gifts can be made to the hospital to immortalize individuals. There is also the option of gifts of resources which enable one to offer time and skills, building materials, prayers for the project, or work on the construction site. Partnership is also expected through monetary donations. In Nigeria, make donations in check payable to Bola Adewunmi Global Mission Outreaches Bagmo, or funds transferred directly to the ministry account at Wema Bank PLC account 027 105 012 6416. In USA, make your tax deductible donation payable to New Creation Revival Ministries International, NCRMI, and specify that gift is for Grace and Mercy Hospital. Mail your offering to NCRMI, P.O. Box 14194, Humble, Texas 77347. Missionaries, both clerical and medical personnel, are also expected at Grace and Mercy Hospital to volunteer their time and expertise. The clergy will work in the chapel wing of the health complex and double as pastoral care staff, serving as counselors and facilitators to patients and families in times of crisis and stress. Medical missionaries, doctors, nurses, pharmacists, lab technicians, clerks will serve in different units within the hospital. We are using this opportunity to call on individuals, churches, and corporate bodies to become